Welcome to this video by Fine and Data Media. If you enjoyed this video, please like and subscribe. As always, you can check out fineand.com.au for the full article, also linked below. Today, we're going to look at how Australia prevented a COVID-19 disaster in March 2020 and how these lessons could prevent a second wave. The data I'm about to show you will show how Australia was just in time in the lifestyle changes its people made to prevent the rapid out-of-control spread of COVID-19. We are going to use two stats to do this. Firstly, the local daily infection rate in Australia per 100 active cases. This is just the infections which occur in Australia. It does not include Australians or foreign nationals who came to Australia with the virus already. This stat will give us an idea of how good Australians are over time at avoiding infection from people who do have COVID-19. Examples of things which could affect this rate are hand washing, social distancing, 14-day quarantine on arrival to the country, as well as any other actions Australia have taken to avoid the virus. For more information on how I've modelled a daily infection rate, check out the full article at fineand.com.au. Secondly, we'll look at the number of active daily cases. The reason I've chosen to look at these two statistics, and the main takeaway I want you to have, is that if both the infection rate are high and the active cases are high, then COVID-19 is out of control, and we have a disastrous situation like what we have seen in many other countries around the world. Okay, let's start looking at the data. We start looking at the situation leading up to March. On the top, in the teal, we have our likely daily infections per 100 cases. On the bottom in the red, we have active cases on a given day in Australia. I've also included daily COVID-19 related headlines from ABC News in yellow to get an idea of how public perceptions and activity is changing through the time period. There are many factors to controlling spread, not just government lockdown. Now, as the data starts to roll, let's talk about what I mean when I say if both of these statistics are high, then we have a problem. If we make a conservative assumption that the average person who tests positive for COVID-19 is infectious for 10 days, then we can say that if the likely daily infections per 100 cases is higher than 10, then we have exponential growth in COVID-19 cases. We begin March with this rate well above 10. Fortunately, at this time, the active cases in Australia were still relatively low. There is still time to act to slow down the infection rate. It's when the active cases gets into a few hundred to 1,000 range that it starts to become too late to act and the situation spirals out of control. Australia starts March at the precipice. Daily infections are high and the number of active cases is rapidly approaching a point where it will become much harder to fix this. Basically, to avoid disaster, Australia needs to get the daily infections per 100 people under 10 before the active cases gets too much higher. You would have seen from the headlines that Australian society is fundamentally changing by this point. Soaps and hand sanitizers are sold out. People are afraid after being exposed to global media and the horrific situations evolving in other countries. People are now aware of social distancing, they are practicing hand hygiene, and they are also starting to limit their exposure to public places where possible. Due to all of this, by the 8th of March, likely daily infections are slowly falling. The rate is still above 10 though, and more must be done to prevent the exponential growth of new cases. By the 8th of March, we can also see the effect of the high transmission rate through late February has had. Active cases are exponentially increasing as more people start to feel symptoms from infections they picked up throughout this time. This lag is due to incubation time. At any given time, the number of new cases reflects the measures a society took about a week previously. Infection rates plateau up until the 13th of March. The 13th of March is when there was a large shift in Australia's approach. On this day, a ban of gatherings of over 500 people is announced, and many companies begin to work from home. This shift is just in time, as active cases approach 1,000, which represents disaster when combined with our still high, likely daily infection rate. These changes and subsequent further restrictions on people continue to push down the infection rate, even as active cases continue to grow due to the effect of incubation time and infected overseas arrivals. We can actually begin to see an inflection point in the active cases in the middle of March. This is when exponential growth stopped and is the point where Australia regained control over the spread of COVID-19. By the start of April, it has become obvious that Australia is doing very well in its fight against COVID-19. This has continued through to June when this video was made. Looking at this data, we can see that there were two main phases where Australians were making changes that ultimately put them on the path away from disaster. Early March, when individuals began to make changes such as personal hygiene and social distancing, and then again in mid-March, where the government restrictions on gatherings began to be announced, and small and large companies Australia-wide began to put in place work-from-home arrangements. Australians have shown in their country that for them, these measures worked when enough of society committed to them. Australians must be ready to do so again if the second wave does look likely to be starting. I will also finish this video by acknowledging that COVID-19 stats are not merely stats. These are people and families who have been gravely affected by this terrible disease. As of June 7, 2020, 102 Australians have died from COVID-19. For them and their families, this is a disaster. I hope that the information in this video can prevent more deaths in the future. We hope you've gotten value out of this presentation by finding Data Media. Please follow us on your favourite social media and subscribe to our YouTube channel for more data media in the future. Our next article and video will be asking the question, hypothetically, what if Australia had made these changes slightly later in its fight against COVID-19? How bad would the situation have gotten? Thanks for watching.